Hi, welcome to my channel. Please, if you haven't subscribed, pause the video and subscribe. Have you ever wondered what doctors study to become what they are, or what medical students spend 40 hours of their time a week doing? If yes, then you are not alone. If you are aspiring to be a medical student, then there's a high chance that you have asked yourself this question once or twice. It's not a secret that the outside community has little or no knowledge of what goes on in medical school. Today we are going to cover the disciplines that are studied by physicians in their training. Please note that the curriculum I'm covering is that of 6 years of medical school and not that of the US and Canada, which is 4 years. As a first year medical student, you start with courses like chemistry, biology, and physics. And of course, you only cover areas associated with medicine. In chemistry, you study the basics of organic chemistry and study things like enzymes, hormones, and their functions in the human body. They only teach you basic organic chemistry and keep the advanced level for biochemistry. In biology, the first semester you study general biology, genetics, cytological methods. You study heredity, variations, and everything that has to do with basic human biology. This can sometimes be tricky for many first year students because the teaching methods vary from that of high school. In the second semester, you concentrate on parasitology. This is the study of medically important parasites. You study the most important groups, which include sarcodinates, helminths, and arthropods. You study the morphology as well as prevention and possible treatment methods. In physics, you only study the concepts associated with the medical treatment equipment and methods. This sometimes is studied for just a semester as there is not much to be covered. The most important courses covered in first year are anatomy and histology. Anatomy is studied for 3 semesters, which goes into second year. Here you study the organs in the body and their positions and to which systems they belong and operate. You start with the skeletal system, which is the simplest and the easiest of all the way to the nervous system, which is the most feared system by students in the anatomy world. If you have a good professor, this is a very good foundation of medicine, especially for aspiring surgeons. Then comes histology, which is the study of tissues and cell types and development, all done with the help of the microscope. Here, you learn to identify different types of tissues on the human body and their characteristics. If you survive first year, you then proceed to the second year. Here you have already gotten used to the stress of medical school and should be prepared to carry more weight. Have you ever wondered why you don't understand your doctor's writing and why the pharmacists are perfectly able to interpret it? No, it's not a bad handwriting, it's because it's written in Latin. In second year, you learn medical terminologies which are chiefly in Latin language. So everyone in the medical field is taught this, and that's why they all understand each other's notes. The language of medicine is universal. You also study physiology, which is one of the most important medical courses. A doctor needs to understand the normal human body function to be able to judge when there is something wrong with it. You do this for, of course, 2 semesters. Some students find it extremely difficult, while some are indifferent. I've never met anyone who said it's easy. Anyway, it depends on the individual. You study philosophy. Here you study the fundamental nature of knowledge and reality and its existence. It's all to prepare your mind to reason independently and understand and interpret every situation that comes your way. You also study a bit of sociology to understand the society better. And lastly in class, you get to study economics to help you understand the financial market better. And after every year, you undergo compulsory 2 weeks of physical training at the hospital where they teach you patient care and emergency medicine. So guys, for today, that is where we're going to stop. We're going to stop in second year, but subsequently we're going to be covering the remaining years. Don't forget to subscribe to my channel for more videos like this, and if you love this video and found it educative, please subscribe to my channel and like it. Thank you.